guys, welcome back to my channel, and this is still your introvert Gail. For those who have not subscribed to my channel, please do subscribe to my channel. And of course, I would just like to take this opportunity to thank the those who have subscribed already, and for those who were like asking um, for me to speak in English so that they could understand. Here we go. I will try to speak in English as much as I can. And also, as you can see, I have a new background. So let's get started. Oh, by the way, before that, I would like to shout out KK Cortez. If you're watching, shout out to you. She's a very good, very good coordinator, wedding coordinator. So as we all know that we have postponed our wedding, but all right. This topic or this blog is all about the difference between working as a nurse in the Philippines and working here in Australia. So everything that I'm gonna tell you guys is actually basically based on my experience, what I've noticed between working in Philippines and in Australia. So I have actually 10 difference. My number one is of course facility. So as friends that I can see, especially me working in an emergency department, is that in the Philippines, the entrance of the ambulance and where people are coming in and they only have one entrance. They only have one entrance, so that's already the ambulance and also the entrance for the people, for the ambulant people or ambulant patient. So unlike in Australia, emergency department has always two entrances, and then the other one is ambulance bay, wherein all the ambulance personnel or ambulance using that entrance for them, and then the other one is for the ambulant or those who can walk or those patients who are also in emergency cases but they can still from their private car or from somewhere, so they have another entrance from there. Number two is the equipment. Of course, in the Philippines, as we all know, working in a hospital graded enough. Like for example, in Australia, this is my first time using bladder scanner. So whenever you have a urinary retention, in the Philippines, you have to go for ultrasound or whatever, and we don't have like the bladder scanner in the Philippines. Even I work in a tertiary international hospital in the Philippines, we don't have that. Although we have IV pumps or we have what else, other equipments, but we still don't have some of the equipments we are using here in Australia. So in Australia, you can see bladder scanner, you can see some hoist machine that we don't have in the Philippines. As we all know, we do the lifting all the time in the Philippines, which is not really good. But here in Australia, they have the equipment to transfer the patient from the bed to wheelchair to bed, or bed to bed, and so forth. Number three difference is the language. Of course, when I started here, I was like very overwhelmed with their language, as because in the Philippines, yes, I do speak English, and since I work in a tertiary hospital, a lot of people or a lot of foreigners are also going to that hospital, but normally I use American English. But here it's very different because it's number one, it's Australian English, and there are terms that is different from the terms that we use in the Philippines. Like for example, when I started doing a carer job in a nursing home, face towel is flannel, undershirt is singlet, and slippers, thongs. And what else? And of course, the medication, the ceftriaxone. Oh well, ceftriaxone in the Philippines is ceftriaxone here, and cephalosporin in the Philippines is cephalosporin here, or cefazolin or something like that. So there's like some kind of language adjustment that you have to face when you're working here in Australia. Number four, break time. This is one of my favorite when I transferred to Australia. the break time, because in the Philippines, when you're working as a nurse there, normally I do get my break once in every shift. For example, my shift is from 6 to 2 p.m. 6 in the morning to 2 p.m. And then I will just get my break at around 7 or 7:30, and that's already my whole meal for the whole morning, and that's already my lunch, that's already my breakfast and my brunch or whatever. But in Australia, when you get to work here, you always have two breaks in one shift. So one is tea break or morning tea, and the other one is lunch break or dinner. So you have 15 minutes on the first break, you have 30 minutes on the second break. This is my favorite part in working here, like a lot. I get to eat more. Fifth. The fifth one is, of course, salary. Very different. In the Philippines, you have 15th and 30th. So you get to get your salary on the 15th and 30th. And also, it's constant unless you have PM differential or afternoon differential. It will vary. Australia, you always get your salary every fortnight. So most of the hospitals, they pay their nurses fortnight. That means every 2 weeks you get to have your pay. And also, one more thing is that every Saturday and every Sunday they have different pay. So from Saturday, you have additional 50% of your salary in a day, and for Sunday, you get to have 75% increase of your salary, and that is so much different. And also you get to be paid per hour here, not per month or per cut off. We are earning dollar, we are earning peso. Number six is the patient ratio. So patient ratio is normally 1:5 max, or 1:6. That's maximum. And you get to have like your allocation. You're just allocated on this area. Unlike in the Philippines, I have just experienced 1:2 unlimited, and even hallways. You get to look after the patient in hallways, and because that's still your area. But in here in Australia, so if we have an overflow like that, like in the hallways, they will add another nurse to look after the patients that are in the hallways. So number 7. So my number 7 is documentation. We have different kind of documentation, especially in emergency department. So before, in the Philippines, what we use as a documentation is narrative. So like, you'll really tell everything that happened to the patient and what were you doing, and then follow all the orders of the doctors. Like for example, they're gonna have their bullet points. IVF to run for 12 hours, something like that. Then you just have to follow each steps or each orders. Unlike here in Australia, when you're working as an emergency department nurse, our documentation is A to E. So when it comes to A to E, that means what's the airway, what's the breathing, what's the circulation, what's the disability, and the exposure. So you give your story, and then you go to A to E assessment. And also, we are not really following orders here. It's actually, it depends on you. If what's the presentation of the patient. If it's like chest pain, let's see chest pain, what will you do? You have to do an ECG. You don't need to wait for your doctor to tell you, do an ECG. Unlike in the Philippines, normally, before we do such procedure, although we know that the patient needs an ECG, we still have to wait for them to write it and to order it verbally or whatever, and before we do the procedure. But in here, you just do whatever you want. Do the blood sugar, do everything, do urine dipstick, do everything. So basically, you're quite independent on the procedures or the assessment that you're gonna do. Number 8. So my number 8 is handover. In the Philippines, as an emergency nurse as well, we transfer the patient by ourselves and then we hand over it to the other nurse. And then we hand over everything, every single paper, everything that happened to the patient. Unlike here in Australia, when we do hand over, escort the patient to the ward and hand over it personally. But there are cases that we don't need to hand over personally, but we could just call them, and then the orderly or the PCA will take the patient to the ward. And it's experienced before, like just ring them and then okay, they're happy. They're normally happy anyway. In the Philippines, I don't know. They're like very strict with everything that you're gonna do. And like for example, your fluids, what time did you start this? When it's gonna finish. Unlike in here, okay, I'm running it for 12 hours, that's it. You are done with handover. And it is so much easier. But yeah, that's the difference. Well, being strict in the Philippines with your co-nurses to hand over, it's also good anyways to make you better. But sometimes there's no more time. So it's all for the patient's safety anyway. So number 9. The waiting times is my number 9. So when I was working in the Philippines as an emergency nurse, our waiting time for the patient gets to be transferred to a ward if he has a referral to cardiologist or endocrinologist at the same time, or medical team at the same time, or surgeons at the same time. All the specialty doctors to go to emergency and see the patient before the patient gets to transfer to the ward or to the room. And that's how we do it back then. Unlike in Australia, when we transfer our patients, sometimes even it hasn't been seen by the medical doctor, as long as the resident doctor in emergency has already hand over this patient to the medical doctors upstairs or in the ward. It's all good to go as long as the patient is stable. So that's quite different system. And also the waiting times of the patient being seen. In the Philippines, we don't really have like a specific time to be seen. As far as I remember, as long as they're critical or in a medical area, then they have to be pulled out from the waiting room straight away or immediately. But unlike in Australia, they have their triaging system. They have ATS 1, 2, 3, 4, 5, and then there's a specific time allocated for that category. Last but not the least, my number 10 is specific roles in doing CPR. So the difference is that in the Philippines, when we were like doing a CPR and you are allocated in critical care, have this teamwork that's innate. Like once there's a cardiac arrest patient, all the nurses goes there, and then all the nurses try to put a line. All the nurses assist in the CPR, everything. All nurses assist in airway without us telling what's your role or whatever, or what's gonna be your role. So everyone tries to help. In Australia, when I started working here, and when we do CPR beforehand, there's already your task, and you're not allowed to do another task. If you're an airway nurse, you're gonna be an airway nurse the whole time. If you're gonna be a circulating nurse, then you're gonna be a circulating nurse. You have a specific role, and you're not gonna go beyond to the role unless the scribe nurse or the lead nurse will tell you to do so. So I hope you had fun watching this video, and I hope you have learned something, idea of what's the difference between working in the Philippines and working here in Australia, or for those who are not working in the Philippines or wherever you are. So that's how I see it. I actually noticed the difference. So if you have any questions or any comments, please comment down below and I will try to answer your question. Alright, see ya! Bye-bye!